Hi, my name is AnneOliver. I'm the clinical coordinator for speech-language pathology at All Children's Hospital in St. Petersburg, Florida. I am also a speech-language pathologist, and my interest has always been working with children with hearing loss, specifically teaching them how to listen and speak. My mentorship experience with the first year's program consisted of working with Karen MacGyver-Lux of the Learning to Listen Foundation in Toronto. So mine was 3 parts. The first part, I went to visit Karen at the Learning to Listen Foundation for 5 days, and then several months later I went again to Toronto to observe Karen at the Learning to Listen Foundation for 2 days, and then lastly Karen came to see me at All Children's Hospital for the final part of my mentorship, and she observed me in my workplace for 3 days. And also another very valuable part was that Karen reviewed 3 videotapes of me doing auditory-based therapy with a child over a period of a year or 18 months. All of my first year's experience was very, very good, but to me the mentorship was the most valuable part of the experience. And I think that was because I have almost 20 years experience as a speech-language pathologist, and it had been a long time since I really had a mentor, if I ever really had a mentor. And so it was good to have someone with more expertise than me to learn from. So that was a great part of the first year's experience for me. I had been pretty much self-taught on everything I had learned about auditory verbal techniques. I had attended conferences and done observations, but so it was really a special thing for me to be able to get feedback on my treatment from someone with a lot of expertise. On my first visit to Toronto, mainly I observed Karen doing AV therapy for 5 days. I saw between 16 and 20 therapy sessions, and during that time I actively took data for each session in different areas: audition, language and cognition, communication, behavior, and parent training. And then after each session, Karen and I discussed these areas for each child. I didn't really do any direct treatment on that visit, but I did do some parent counseling when Karen asked me to, as well as directly participated in some treatment activities. So I said when I wrote my mentee summary for the program that the top 5 learning outcomes from the first visit were things like realizing the importance of optimal amplification, ways to increase parent participation, how to build cognitive goals into each session, and auditory verbal therapy for infants. My experience had primarily been with children 2 to 17 years old, and it was great to see some auditory verbal therapy with babies, since we're getting a lot of babies in therapy now. Following this visit, I returned to my facility and incorporated what I had learned into my practice. In my position as clinical coordinator, I supervise SLPs at our main hospital and in 10 outreach locations. So it was really far-reaching what I had learned, because I could apply it and share what I learned from my mentor with all the other SLPs in our system that are providing therapy for children with hearing loss. So that was great. In fact, I was so enthusiastic about my experience at the Learning to Listen Foundation that I came back and wrote a proposal to our hospital foundation to get some funds to improve our services for children with hearing loss. And that subsequently got funded, and we got some funds for training and materials that we have been really excited about improving our program. My second visit to Toronto, I observed Karen again doing therapy, but this time, however, I actively participated in therapy several times. I did the listening checks with the kids. I helped formulate goals, and Karen frequently turned over a treatment activity to me. And then she was able to give me feedback. Also, we specifically tailored my program to meet my needs. Karen asked me what my goals were, and I had a few things, for example, working with infants and learning about speech babble that I was interested in, so we made sure we hit those areas. And we also talked about children with auditory neuropathy, which was a big topic at the time and still is. And then we kind of moved on how to increase the difficulty of therapy goals. And then the next thing that happened was I continued to videotape myself doing therapy with children, and Karen provided feedback on how well I was maximizing audition and using the other auditory verbal techniques that she had taught me. So that was very valuable too, the videotape feedback. The third visit with Karen came to see me at my workplace. So she watched me supervising other people doing therapy and provided feedback to both of us, which was very helpful. And then she watched me do therapy with a few of the children that I do therapy with and gave me feedback there as well. She also came to the team meeting with the audiologist that we have as part of our cochlear implant team, and gave us some direction on how well we were, in fact, doing best practice with these children with hearing loss, and that was very valuable as well. In summary, the mentorship experience was a very important factor of my first year's program. I was very fortunate to be matched with someone who not only was an AV therapist, but also the coordinator of clinical services at her facility, so we had much in common professionally. She was everything you could ask for in a mentor. She was caring, organized, and encouraging, not to mention an extremely talented therapist. My mentor was a great role model and really inspired me to be a better clinician. We are still in contact and have more of a colleague-to-colleague relationship now. For example, she just emailed me with a question about literacy because that's one of my areas of expertise, and I emailed her back with a question about auditory neuropathy. And we plan to get together at the AG Bell conference this year as well. So in summary, and lastly, I will say that the mentorship experience was the best part of first years for me. I truly benefited from that part of the experience and appreciated this aspect of first years. Thank you.